working anymore. When you shock them, it will work again. So this shows you prior PD5 therapy. Then previously they had a PD5 therapy and now not working. You shock them, then you see it improves. Now I was telling you about the 6-session therapy or the 12. Now if you do 6 times and then it works, fine. If it doesn't work, continue and do 12 times. Continue until you reach 12. You will add on another 33% in success rate in the people who did not respond. So 1/3 of the non-responders, 1/3 of those who did not respond with a 6-session treatment will now respond. So if you add on to 12 sessions. Now how about follow-up? 1 year follow-up, you see 1 year, maintain. And this is a two years follow-up. You can see the improvement. ED domain, 35%, post-treatment, 50%. They're all durable. My patients have reached about 3 years, and I have a few failures, but not a lot, very few. And if you do studies, this is a placebo, this is showing you the peak systolic velocity improving in the penis after intervention. And this was the initial, this is how it works, you see. And this is a picture taken of me actually, and holding the penis one hand and shocking with the other, okay. Now let me show you my first reported result, May 2014 to May 2015, 1 year result. 200 patients in 1 year, and you got ahead of me. I cannot let you be better than me. I've got 300, I got 200. Okay, 2 years. Okay, this is a 1 year study of 200 patients, which I had 12 patients who had Peyronie's disease. So this treatment can also work with Peyronie's disease. It softens, it will make the hard plugs soft, and it will improve erection also. So I use it in 12 Peyronie's, but 200 ED cases. This CPPS means chronic pelvic pain syndrome. Can be used for that also. So for ED, improved to EHS, erection hardness score 4, 37%. Erection hardness score 3, 40%. 2, 8%. 1, 15%. So total success rate, if I would only add these two, this one, improvement is not very big, so I don't consider a success. So if I take these two as success, 3 and 4, then the success rate is 77%. Very good. Now these are the cases, the 200 cases just show you. Majority were between 50 to 69, and they had the best improvement at age. And this is those who had the improvement to the score 3 and 4, 1973 out of 200. You see, majority again 50 to 69. The failures followed the same pattern, but not many, you can see. Failure means I only reach a success of 1 or 2. So to me it's a failure, but actually there was some improvement. So the patients are not really complaining, but there was some improvement. I thought it was failure, so I put them as failure, but not many. Now what about, now remember I told you about the metabolic syndrome earlier? Now these are patients with diabetes, these are patients with no diabetes. Notice that the diabetic patients, the red color, had less success. You see, they had poorer success compared to those with no diabetes. And of course, the diabetic ones improved, but they still improved, but they improved very little, minimal number, I don't improve, but they only improved the EHS 1 and 2. Ischemic heart disease, metabolic syndrome, again watch. No ischemic heart disease, improvement. Great ischemic heart disease, less improved. So you must prevent the metabolic syndrome. The lesson to learn today is prevent metabolic syndrome. Treat the patient with testosterone if it's low. Stop diabetes. You see, EHS, ischemic heart disease, look, very poor results. I mean the red one, and no ischemic heart disease, wonderful success. Now how about high blood pressure? The high blood pressure also, I found a very interesting thing. What I did was, the minute they are diagnosed with high blood pressure, I treat them. I bring the blood pressure down before I shockwave them. Then when I do that, notice that, those with hypertension, the results are equally good as those without hypertension. So you must treat the hypertension. Now, again, ischemic heart disease, metabolic syndrome. I want to mention metabolic syndrome here again. Notice, high cholesterol and normal cholesterol patients. Those with high cholesterol, look, the success rate is very low. So metabolic syndrome is a curse for men. Now, testosterone, I told you, is an important factor, right? All of you know if you're low testosterone, your erection is going to be bad. So I having known that, I said, what's the point of treating them when they're low? So I treated them, brought the testosterone to normal. Then I treat them after the testosterone is brought back to normal, and you see the success rate become very high. Then I found, I tried a new method of improving my success rate. What if I would give them a low dose PDE5 and start it before I start the treatment with the shockwave? So these are people who are given low dose Cialis, the red color. Alright? Now, like that you cannot tell anything, so I will show you, I compare with Cialis and no Cialis, it's easier. Those without Cialis started and those with Cialis started. Notice that those with Cialis started had a much better success rate, EHS 4 and 3, look at it. So I give them the Cialis a few days before, then carried on. After the treatment, I carry on for about one more month. If they're happy with it, I carry on with it. If they're not happy with it, I stop it. And those I told you that gave a history of previously having had PD5 therapy, but then after a few years, it did not work. In those patients, if you shock them, you see, non-responder will immediately become a responder after treatment. Not bad. In other words, you put between those given PDE5 before the rate and those who are naive for PDE5, that is, those who never had any PDE5 treated before, notice that those who had it before, for some reason the penis is primed already. So when you shock it, they respond better. And actually there's a reason for it. During shock wave, nitric oxide is released in the tissues actually. Now I have a doctor who worked for me for 3 years before he went back to India. This guy his name is called Vasan. Now what he did was he took 135 patients, 95 he shockwaved them, 40 of them he shockwaved them, but he put a metal plate in front of the shockwave machine. So in other words, he never shockwaved them, although the man thinks he had a shockwave because he hear the banging sound. But the metal plate deflected the shockwaves away. So in other words, it's a real sham therapy. And he published this in the Canadian Journal of Urology, and this showed that those who had sham did not work, those who had the real thing worked. So in other words, this is a real placebo-controlled trial, and it confirmed that the shockwave can work. So now this is for people who have got the machine. And those of you who already bought the machine, you will know how to improve your results. This is the second part of my talk. One way to improve, as I mentioned, you give them the Dalafil 5 mg daily a few days before you start the shockwave. Alternatively, you can give them an ODT 50 mg, say half an hour to 1 hour before you start the ESWR session. Because this tends to work a bit faster. So why do I give a PDE5? You ask me. You look at how it works. The shockwave, this is how the shockwave works. But when I give a PDE5 dose to supplement the shockwave, I'm actually pumping up this part of the cascade. This cascade of the mechanism of action is enhanced. That's why it will work better. So I thought, if this can enhance, is there any other way? So I told you before, I use Tadalafil or I use this type of Viagra. This is not important. Then I thought, is there any other way? So I said, the shear stress, can I maintain this? Will it then work? What if I give the patient a toy, a miniature shockwave or something like that to bring home, to continue doing home every week? So I gave the patient an instrument that can cause vibratory stimulation, so that it gives you the vibration into the tissues to take home to do it once a week. And this was the machine. This is, you put the penis in between these two pads, and then it's electrically powered. It produces the vibration, right? Now this machine is used in spinal cord injured patients for ED. Spinal cord injured patients, to make them have an erection, you can use this. So I took it from that. I run a very big spinal cord injured center, and I do a lot of aerodynamics and all this neurogenic bladders. So I was using this machine for the patients with ED. So I got this machine and put the penis here. Alright, and that's how it works. You just put it like that. And then they can do it once a week to maintain the cascade of mechanism of action I told you about. And then I found that the erection was maintained, the results were maintained. So right now, I've thought of another way of doing it. I'm now injecting a stem cell activator into the penis. Professor Goldstein, Irwin Goldstein, is a famous god of erectile dysfunction in Massachusetts General Hospital. I didn't know he was doing the same thing I was doing. He was also injecting stem cells and stem cell activator into the penis, and he told me it enhances the effect of this shockwave. So now, for those who fail shockwave, I inject it, and I find it works after that. So I have a plastic surgeon that supplies me with the stem cells, but sometimes for convenience, I don't use stem cells. I use activator for stem cells. You take venous blood of 100 cc. You buy this machine. It will split it down for you. The plasma from the plasma or platelet-rich plasma, you know, from the plasma, and then you inject into the penis. It actually works. So this is another way. So I hope I've given you a bird's eye view of the new technology, which will take Vietnam by storm. Already you have 2 machines in Ho Chi Minh, and I believe after today there are 5 orders we made for the machine in Hanoi.
Thank you, Professor. Vâng, quả là kỳ diệu. Chúng ta đã thấy rằng là bệnh nhân rối loạn cương dương ngày nay thì đã trở có nhiều hy vọng hơn. Bởi vì trước đây là nếu trường hợp khó khăn là chúng ta có thể đặt thai thể hai nhân tạo, mà tôi không biết các bạn như thế nào. Nếu tôi mà đặt thai thể hai nhân tạo thì chắc là tôi chả dám có cô nào. Bởi gặp nó phải khỏe từ mình với lại từ hai vật hang thì thôi thà nghỉ nhà cho đỡ mệt. Nhưng mà ngày nay đã có sống ngắn để ứng dụng và điều trị rối loạn cương dương mang lại một cơ hội rất tốt. Chắc là thời gian thì cũng quá rồi nhỉ. Thì chúng ta chuyển sang phần khác để cho chương trình được kết thúc đúng giờ. Đồng ý không các bạn? Thank you, Professor.